Hepatitis, as the name signifies, itis means inflammation. It means inflammation of the liver. Now, inflammation of the liver could be something which could be of a shorter duration, or it could be a longer duration. So we kind of divide them into two types: acute hepatitis, which is of a shorter duration, and chronic hepatitis, where the disease duration is for longer than 6 months. You can also divide them according to the cause of hepatitis. Commonest cause is viral hepatitis. There are 5 viruses which are known to affect the liver: A, B, C, D, and E. And these viruses are the ones which cause inflammation of the liver. A and E cause acute inflammation, that is for a shorter duration of time, whereas B and C cause chronic inflammation, which means it is for a period which can go beyond 6 months. D is a virus which actually only overrides a person who has already hepatitis B. So besides viral hepatitis, the other causes are, you have drugs like medication. Commonly in our country, anti-tubercular drugs are notorious to cause inflammation of the liver. You have anti-epileptic medicines which can cause the same. Some antibiotics can cause. And then of course there's the huge big social tag of alcohol, which also causes alcoholic hepatitis. So there is a huge list of diseases which could cause inflammation. Very commonly now, autoimmune hepatitis is like what we look at it. With COVID being around, there are so many other autoimmune diseases which are coming up. This is another one which can cause. So there is a huge list of causes of hepatitis, and each one of them are different. Some cause acute hepatitis, some cause chronic, which means in some the duration of disease is a short duration, some where the duration is more than 6 months. You know, we have what is called as one kind of danger is when you have acute disease of a shorter duration and the liver goes into failure. It's called fulminant hepatic failure. This is very commonly seen with hepatitis. Viral hepatitis, it can happen with viral hepatitis B. It can happen in adults with viral hepatitis A. Viral hepatitis A was supposed to be a very mild disease in children, but if that happens in adults, it tends to be severe. In hepatitis E, if you see, there are pregnant women who get hepatitis E have a 6 times higher risk of going into liver failure compared to normal population. So in a particular group of patients, hepatitis E becomes a severe form of disease. And when I say liver failure, these are patients who are unable to sustain any of the liver functions, and they are unable to sustain life for that reason. They usually require transplants. If out of 5 patients who get fulminant hepatic failure, 4 cannot survive without a transplant. Only 1 survives. So that's the most severe and the most dangerous forms of acute hepatitis. Otherwise, chronic hepatitis B and chronic hepatitis C are the ones which lead on to cirrhosis, which can lead on further to hepatocellular carcinoma, that's liver cancer and other diseases. Symptoms, again we'll go by the types. If you have acute hepatitis, you will have a shorter duration of symptoms. Typical what used to be jaundice. A patient comes to you with poor appetite. He'll say his urine has turned yellow or his eyes have turned yellow. He's not feeling good, he's feeling nauseous, throwing up. So that is the symptom for acute hepatitis. You examine them, you'll find there is yellowness in the eyes, the liver may be enlarged, tender, and they usually require symptomatic care, bed rest, good diet, and they do well. Chronic hepatitis is the one which is caused by chronic viral hepatitis B and C. Notoriously does not have any symptoms. It can be picked up routinely in a screen, preventive health screen. The only symptom which is commonly seen is fatigue and tiredness. Or you will find that suddenly in a routine checkup, a whole family has been tested positive, because this is transmissible very rapidly. You'll be surprised, hepatitis B is almost 100 times more contagious than HIV. If you require 0.1 ml of inoculum in HIV, here you require 0.004 ml. And it can spread through saliva, through sweat, through urine, through blood, through any of the secretions. So that's why it's like, we compare it. If 100 times you prick a HIV positive patient into a person, one will get it. Whereas here with HBV, with every strike you'll get it. So that's why, as I said, here the symptoms are hardly. Chronic hepatitis per se is one where the disease is prolonged for more than 6 months. They come to you suddenly with features of liver failure. They have fluid in the abdomen. They have swelling of their feet. They have intense fatigue, or they end up with even blood vomiting where the disease has already gone into cirrhosis or irreversible state. So that's why acute hepatitis, easy to treat with shorter duration. Chronic hepatitis, use your skill. And all patients, if they have features of fatigue, or if they have met anyone with hepatitis B in the family, they should all be screened. Treatment of acute, I told you, is just a symptomatic care. Acute hepatitis, acute viral hepatitis of hepatitis A, hepatitis E, which cause. Hepatitis B can also cause acute hepatitis, short duration. And in adults, usually it is so. If out of 100 patients who get hepatitis B acute, 90 will clear the virus, 10 of them can go on to chronic. So the treatment for them is just giving them bed rest, giving them a good diet. Contrary to what people have, that you should stop turmeric, haldi band kar dena, not required. Give them a good diet. Fat restriction is not to be there. Don't have deep fried food, but give them a normal diet. As it is, their appetite is down, so if you give them tasty food, they'll be able to eat better rather than giving them insipid. That is one part. For chronic hepatitis, chronic viral hepatitis, for hepatitis B, you require treatment. You first check out what is the viral load. There is a blood test which can be done. Do a fibroscan and an ultrasound to see if the liver damage is there, and accordingly treat them with tablets. Hepatitis B can be managed. Unfortunately, for hepatitis B, the treatment is indefinite. You have to keep giving it for years and years. Most people will require that. The clearance rate is as low as 1% per year, which means after 10 years also, 10 out of 100 only will clear the virus. Others will require the treatment. In hepatitis C, fortunately, after 25 years of research, now you have a cure available with 12 weeks of therapy. Oral drugs, these are directly acting antivirals, 12 weeks, and hepatitis C can be cured. WHO has taken this that by 2035, it's going to eradicate this disease from this face of earth. In India, we have close to 20 million carriers, positive patients of hepatitis C. Unfortunately, only 10% have been offered the treatment so far. It's because of lack of awareness, and that's why World Hepatitis Day is celebrated, where we conduct camps, we carry out tests and make people aware about it. Because if we can offer them treatment by 2030, India can also eradicate hepatitis C. Hepatitis B, I guess, is going to take some time. Since we have a huge population, we have about 50 million carriers in our country. The carrier rate is about 4%. And you'll be surprised that almost 1 lakh people die of hepatitis B and its complications in our country, which is almost, or if not more than patients who die of HIV or tuberculosis. So it's something people have to be aware, because the commonest thing, the first thing you should do is prevention. So when you talked about treatment, first part comes prevention. Hepatitis B vaccine is available in our country since 1991. It's part of our extended program of immunization. Yet, we have not been able to eradicate this disease. I think more awareness has to be done, more vaccination has to go into interiors, and we can prevent the disease. It's a 100% preventable disease.